A lot of my research has looked at childhood adversity, adverse childhood experiences that might occur all through childhood into adolescence, and the strong impact that has. And that's well established. But we're also measuring the positive. And, it turns out that the more you can surround a child and a family with positive experience, even if you have negative experience, you can minimize some of that impact. And even if you sort of decrease the age at which, make sure that you have interventions where youth aren't experimenting with drugs quite as early, if that is pushed out in the life course, that has a huge impact, because the earlier we have initiation, we have more likelihood of having heavy use and having a substance use disorder in that kind of college age.
This is Brewing Better Health, a series from the School of Public Health at the University of Nevada, Reno, where every cup sparks connection and a healthy conversation. Join Dean Muge Akpinar-Elci each month for a cup of Turkish coffee as we pour insights into public health. Today, Dean Muge is joined by Dr. Kristen Clements-Nolle, Foundation Professor and Graduate Director of Epidemiology at the School of Public Health.
Again, thank you very much for coming today and just talking with me about your research and what you do in the School of Public Health. Before starting our regular questions, I just want to ask that as a Turkish tradition, we call the Turkish coffee, and we say that a cup of coffee is remembered for 40 years. And it means that moment means very small act is last longer than that moment. So do you have that kind of moment in your life?
I do. I have a lot of those moments, but I have one that really stands out. I finished my Master of Public Health, and immediately I was hired for a NSF grant as a research associate on a traditional healing project. Which is not what I do now at all. And this was based in Alaska in the Arctic. So right after graduation, I flew up to this very small village, and I'd been working with the principal investigators to learn about the study, and I was starting to prepare everything, because you know me, I like to get things done. I like to get things done.
And organize.
And I arrived in this very small village, about 100 Kotzebue. So it's in the Arctic. And I was staying with an elder who is very well respected. And she said, immediately, all that you did, throw it away. And she said, you need to sit back and you need to listen. And don't be so rushed. Get to know us. You don't know us. You don't know our culture. And so your research will not be meaningful. And that's really stood with me many times, because we get so busy. We're so, and sometimes we have to step back, look at things and listen to each other. And since then, I've worked with lots of different communities where if I hadn't listened, the work wouldn't have been as impactful as it was. So I do think about that a lot.
Because especially like what I said in the Turkish coffee is the same things, just this is a space of reflection and listen each other. I mean, culturally, we don't do the grab the go kind of coffee. Just you need to sit and just discuss. And this is very traditional things too. And but I am seeing also that connection with the public health right now.
Right.
In the public health, we are a little bit different than any other discipline in that sense, because everything is the community based, and they are the priority.
Right.
And your example is perfect for that piece. Just how you can have many ideas with the research you want to do it, but everything can change when you go to the field. So
yeah, absolutely.
That is the part. And I love to hear your research and what you do. Actually, is more than research, what you do and why you do it, and just how you do it.
I mean, I've done different things throughout my career, but I've always been very community based. I've always done epidemiology research. In the beginning of my career, I was an epidemiologist during the HIV epidemic, before we had any kind of medical treatment. And I worked with populations that were sometimes on the outside and weren't given much thought in traditional epidemiology research. So again, I went back to that lesson, a lot of listening. So I've worked with.
Can you explain a little bit the epidemiology also?
Sure.
Because
Yeah.
a couple others, guests talk about it, but we didn't really explain it.
Yeah. So epidemiology is the study of not just disease, but multiple outcomes. So they could be healthy outcomes at the population level, both the distribution of that as well as the potential causes of that or protective factors that may prevent those health outcomes.
And you're the perfect person to explain because every student loves your epidemiology class.
So well, I don't know if they love it, but
they really love that. I know that.
Yeah.
So you were talking about the HIV and other pieces and how that's start there and how you come.
Yeah, and then just other populations. I've worked in the criminal justice system a lot, but I gravitated more and more over time to younger and younger populations. So, we look at sort of different periods across the life course that are important, and the perinatal period is really important. But I was at the time doing all my research with adults, and they were often talking about their children. And so it kind of moved me back in that sort of developmental period. And most of my work right now focuses on early adolescence because it's just a period of rapid transformation, both physical, emotional, social, and the brain is developing. And it's developing in a way that's it's changing. And it continues to change until about the age 24. So it's just a really important exposure period. We talk about these critical periods that wasn't getting a lot of attention. So a lot of people do research with maternal and child health. There was a lot of focus on maybe kind of young adults, older adolescents, but not as much focus on this sort of earlier age group. So I'm, thinking, 9, 10 to 12 before behaviors really start to emerge. About 50% of mental health problems are already starting to emerge at that age group. So we have to move earlier in our prevention.
And actually, prevention is the main foundation of the public health. Just because we want not just because right now everybody is talking about the special mental issues in that age groups, and suicide is increasing, substance use is increasing. There are many issues happening in that age group because what you say is the brain changes and their behavioral changes is happening. But I guess is the people, they are always focused on end point, like how we can stop the substance use or how we can treat it, that kind of mental issues. But your research is really focusing the more prevention stuff because just tell me about that part, just how you are really trying to help that groups and also what is your impact with this study.
Yeah, so a lot of my research has looked at childhood adversity, adverse childhood experiences that might occur all through childhood into adolescence, and the strong impact that has. And that's well established. But what's less understood is what do we do about that? So how do we prevent those adversities from the beginning? So some of our research looks at policies or more upstream prevention that can decrease the stressors, for example, within a household that then can decrease the adversity the children are exposed to. But we're also measuring the positive. And, it turns out that the more you can surround a child and a family with positive experience, even if you have negative experience, you can minimize some of that impact. And that at the population level, which again is public health and epidemiology, can have a profound impact over the life course. So something such as having another caring adult, doesn't have to be in the household. Do you have a teacher? Does the bus driver take an interest in you? Having things to do after school, all of these experiences, and then surrounding, parents and families and siblings with positive experiences. We can't prevent everything, but we really can have a profound impact. And I think that has been interesting for me to see in my research how strong that is. And then on the sort of, when we give our results to policymakers or to programs who are doing the intervention work, it really resonates. People they're tired. They're tired of the negativity. And so it's helpful to see that there's actually strong scientific evidence showing that these positive things can have just as strong of an impact. So that's a lot of the focus right now.
And also, I guess you explain a little bit that part, why you really choose to focus to this development period, because you see that if you change really small things, its impact is huge, just because you are catching very early stage and just how you are changing the impact. Because in the end, all the research, what we try to do is impact for us. Am I right?
Yeah, absolutely. And even if you sort of decrease the age at which, make sure that you have interventions where youth aren't experimenting with drugs quite as early, if that is pushed out in the life course, that has a huge impact, because the earlier we have initiation, we have more likelihood of having heavy use and having a substance use disorder in that kind of college age. So even that, yes, we would love to prevent entirely, but just preventing for a few years over the life course has this impact that's profound.
That is very important piece. And I just want to go back to also your research, because again, because you are doing a lot of things in community base, and just your data collection is community based. And going back to your example with your early career time, what is the challenge when you go to the communities and just, when you do this kind of research and just asking them to participate, or any other challenge, just because a lot of work, people sometimes they don't understand. They are thinking that we are just on the computer, we are doing a couple things and just giving some results and that's it, but it's not.
Yeah.
So
I think some of the challenges are just taking the time to build trust. So it's not just the community members, but I do a lot of work in systems. So in the education system, in the juvenile justice system, these are large bureaucratic systems, and it takes time. And just as important as it is to listen to the community members, it's important to listen to the people who are your partners. So a lot of work goes into partnership building, and keeping those partnerships strong and making sure we return the data, not just to the communities, but to those partnering institutions, because that's what creates a lasting, relationship where you can do this work. If you don't do that, it's very challenging, and you probably won't succeed. But it's time consuming. It takes a lot longer, but it's the right thing to do, and it's what we want to do with public health. But that returning the information and then listening up front and taking the time is it's critical.
Yeah, because, again, everything is relationship building. Because when you build that relation, like we are sitting and talking and sharing the coffee, that trust is building, because you know what I am thinking, I know what you are thinking, and we have a more open platform to share our opinions. So that is very important, and this is the biggest challenge in the public health, building to that trust. And going back to the challenge, but just also is if you are in the field, always there is something happen, and just in the public health, what's always we try to teach that you need to be flexible and adaptable, constantly change. I have one example, but I want to ask you too also. I was in Caribbean and we were doing the occupational health related to research, and I need to give the presentation to workers to talk about occupational health and other things. I have the all slide machine, everything. I have it with me. I went to the plant, and the plug is not working because they are the British. I have the American version. So in that moment, you just go to the another shop and try to find something. You need to adapt. So in your research also, do you have that kind of moments? Just
oh yeah,
you need to adapt and change every plan in that moment.
Yeah, I mean, I had one study that was looking at, it was a randomized controlled trial, so it takes a lot of time to set up, and it was with people who were living with HIV who were exiting jail. And it was an intervention that was called home-based, which was a place where people could live and they had services and social support, and we're comparing it to the control, which the control of the standard of care in San Francisco is quite good. But really seeing if we can, help people, particularly with this transition period. And it's not too long into the study, probably we had enrolled about 120 people. A judge decided he loved this intervention and he was court mandating people to go to the intervention. Ooh. And we had to adapt. We had to change because it was at that point, and we were going to flip it anyway. Yeah. We were going to make sure everyone got the chance. But that just happened, and randomization is broken. But we adapted and we learned from that. But it happens. I mean, things like that happen all the time.
Because it's, again, in the community-based field studies, this is not a lab space. You right. don't have a controlled environment. Everything can be changed with anything right. else. Just wildfire come and you Absolutely. Cannot do your study. That's it. You need to adapt or something else. But going back to that trust piece, just because you mentioned that how time consuming to create, but right now there are many misinformation and miscommunication is happening around the public health in many parts of the public health, and also that distrust, just how. And what do you see in your research site, but also as an overall public health? What is the problem, and do you have any ideas how we can solve a little bit to this problem?
Yeah, I mean, I think there's sort of always been a misunderstanding of what public health is. So, every chance I have, I'm always trying to educate who I'm working with, because we work with people who don't necessarily know. We assume they do, and they may even be working in the field, but they weren't trained in this way. Great. So they may have come from a medical field, for example. So I think that, always kind of taking that opportunity to help people understand what we do and why we do it and why it's so impactful is helpful. I think the community often doesn't understand because we don't communicate enough, and we don't communicate in terms they understand. I mean, you said, what is epidemiology, right? Like most people don't understand what is epidemiology. So I think that's a piece. I think our students are our greatest ambassadors. I think the more people who we have trained, who understand and can go out and do that work, they can say it in a way that is just so much more approachable than sometimes those of us who've been in academia for a long time, for example.
But also with this, because of this distrust and many things we are trying to deal right now, and it causes overwhelming situation for the practitioners and our students going to this field, and they are overwhelmed, they are stressed, their moral is not high anymore. So do you have any advice for them also?
Yeah, I mean, I have these conversations almost every day.
I'm sure.
Either with incoming students.
As a program director.
Yeah, who are thinking about the field, and now our students who are getting, as they get closer to graduation. So, I mean, there's a couple of things. One, this isn't the first time we've been here. So history isn't exactly the same, but I can talk about, when I was young, this is what I experienced, your age. And in some ways it made the public health community stronger and had greater conviction for what we were doing, sort of a call to action. So we've rebounded, and we've also done a lot of great work with very little resources. And sometimes that helps us be creative and think of doing things. We don't have to do things the way we've always done them. Adaptability, absolutely. So kind of showing them that. And then really trying to help them understand you don't have to be employed as it's not going to necessarily say you are a public health official or you are an epidemiologist, at this health department. So, for example, I have a student who recently was hired into doing kind of more city planning, and it was the skill set that helped that student stand apart. They loved the analysis skills, they loved the training he had, they loved the way he was thinking. He's not trained in city planning, but they saw that skill set and that helped him stand out. And so, public health is everywhere. City planning, good city planning is good public health. So he just had to tell that story, and he was able to do that. So I think there are other opportunities that, students can think about. And, do what you love. Exactly. I mean, once I found my way into public health, and it took a while, that was my conviction, I was so passionate about it. You don't want to do something you're not passionate about the rest of your life. And this is going to be a short period. I do believe that. It doesn't always feel that way, but it'll be short.
No, I feel that way, just how nice that you are giving to that example to your students that public health is everywhere. You can work any different space. It doesn't need to be just a health system. It's very hardcore health system. You can just go to work with the engineers. You can go work with the politicians. Just according to your interests, according to your what you wanna do it. And it was so interesting, actually. That my son is in engineering, and we were talking, and he picked the one elective, and the elective is refugee health and engineering. And until he take it, I didn't really think that way. Just because this is a little bit, just why
are these two things together?
Exactly, but it is together because, and what he's telling me that, I am glad that I heard the incidence prevalence from you because I didn't know. But engineers work in public health piece, but in the same things, we are working in the engineering space too. So, because I really believe that solution, just if we have a problem, solution is interdisciplinary. It's not just my discipline or discipline, and how we can go, and hopefully our students really can see that part. I just want to very quickly talk about your teaching also, just because sometimes in academia, just we separate the research somewhere, teaching somewhere, your service is different. But in the public health is very integrated thinking. So can you talk about that part a little bit?
Yeah. So, I think teaching includes mentoring as well as teaching. That's a part of it. I try to involve my students that are doing research in my lab give them some, opportunities to teach. And that is a great way for undergraduates to see what master students are doing, for master students to see what doctoral students are doing. And then that informs our research. So sometimes when we present, we hear something from students and think, oh, I never thought of that. What a great, perspective. That is actually something we could test. And then we go back and, we actually have the data to maybe, explore that. The other way is, just a lot of examples, a lot of real life examples. I try not to make it about me when I'm teaching, but bringing in current.
But your experience
also.
Exactly.
Yeah.
And because sometimes we really need to turn it as a public health is more personal and more humane side we need to show. It is not just the numbers or statistic you are giving. It's really just you are using your background and showing that what you did. Like again, your story is in the first when we start with Antarctica. You just getting to that understanding is very, very important. I want to ask to go back to your, again, early adolescence part a little bit, and just right now school is going to start, and so do you have any advice to parents and or the kids, how they can keep themselves healthy?
Yeah, I think, it's again going back to the conversation here, relationships. Relationships are very important, and making sure that young people are supported in all their relationships, right? So it could be relationships with peers, could be with their parents, could be with their teachers, it could be online. Having the time like this to talk about those things. Maybe you can't have dinner together every night. Maybe that doesn't work with your family, but make that time and that space to have conversations. Check in with your kids about how they're doing and let them check in with you. Like sometimes we don't, kids are smart. they know what's going on, and give them some credit and give them that space. But creating that time and that space to really understand. And if there are areas where people are struggling, there are resources. Reach out for help. There's nothing wrong with that. So I think that would be probably my biggest takeaway.
And also that, again, with this, not, I don't want to say anything, but use a more misinformation, again, disinformation piece with the social media and other pieces. So how they can protect themselves a little bit, as not just adolescents, but parents, actually.
The social media is tough. It's very difficult because it can be very protective for some people. Some youth are isolated and they kind of need that connection, but it can also be harmful, and we don't know what we're getting. Again, sharing that information. So maybe it's not parents sharing with youth, but maybe it's an older sister working with, a younger brother, and trying to help them navigate, because they don't know. They're getting bombarded with information and they don't know what's true. Just in my class last night, we were talking about, where do young people get information on sexuality? They go to the internet because they're not always getting enough information, but they have questions. We need to make sure that's accurate information, and the family has to play a role in that. Just taking a phone away doesn't do it. No. They are going to find a way. So being part of that experience, sharing, talking about, again, that's an opportunity to talk about things, and then reach out. If you don't know the answers, reach out.
There are a lot of resources.
A lot of resources. Yeah, but the just take away, we know that in many areas. They're going to find a way, and then they're going to hide it, and you don't want that. But it's a tricky navigation for sure.
It's tough. As a mother, also we know that part.
Yeah.
As we're finishing our coffees together, and I just want to ask you, what's give you hope for public health?
I mean, for me, it's the students. It just is. Every day I'm inspired by the students, and I see a lot of potential in where they're going and what they're doing. That gives me hope. And the mission, the future's there. And they can shape that. I just think we need to, help them find their voice and their confidence to do that. But for me, it's absolutely the students.
Certainly, they are the future again, and we need them. But thank you so much for
being
with me today and sharing this space and sharing your stories. It was really great to hear from you. Thank you so much.
Thank you for having me.